So with small intestinal strangulations being acute and painful, can we say the same about large? If we could, that would be a really easy way of distinguishing surgical cases from the medical ones, but unfortunately it doesn't work that way. Large intestinal accidents have very similar features to the small intestinal ones in that you have a displacement or a twist that obstructs the lumen, and it can be severe and complete, requiring a manual correction. But because the large colon is so much larger, the pain is usually more gradual and insidious, often underestimated. And all of a sudden, it becomes a raging emergency and violent colic. The difficult part with these cases is that because it takes time for them to become obviously surgical cases, the bowel has started to begin and devitalize. Recovery can be more complicated. An exception to this is if the mesentery is caught up, then you get the acute pain response from the mesentery that's alerting us to the big problem a lot faster. So unlike the small intestinal lesions, large intestinal colics start mild and moderate sometimes, and then just don't resolve. They progress and they become violent. An example of a case would be a mild colic that's been lingering all day, and finally the owner calls of an evening and you treat it as a displacement. It responds initially and everybody goes to bed, but then when the owner checks on it in the morning, they see their horse has a swollen face and they look all beaten up, maybe even cast in the stall and depressed. Now we have a horse that's been colic all night and it's in big trouble. The surgical treatment is similar to that of small intestinal lesions, requiring an enterotomy and evacuation used to decompress the bowel. We may also do a resection if there's an area that's been devitalized. The trouble is that shock preoperatively and a postoperative ileus might be more common, and these are complications that can contribute to a poor outcome than the actual initial lesion. These are the ones that keep me up at night for sure. Surgical colics are therefore anything that strangulates the intestine, like a torsion or an entrapment. But external things like tumors or lipomas can also lead to the same bowel obstruction. And in some cases, the bowel might actually become compromised from within due to poor perfusion or a pressure necrosis from an impaction. And this will also need a surgical correction because the bowel cannot recover from that damage.